welcome to the THCB Book Club. It is our monthly opportunity to talk to a leading author in the healthcare arena. I'm Jessica DaMassa, that's Matthew Holt, and our literary genius joining us this week is Rosemarie Day. This is her book, Marching Towards Coverage: How Women Can Lead the Fight for Universal Health Care. She's also the CEO of Day Health Strategies. We'll talk about that, I'm sure, a little bit. So Rosemarie, welcome. It's a pleasure to have you with us.
Thank you. Thank you so much for having me here. I'm delighted.
So we were talking about before, Rosemarie, it's your virtual book tour, because you just published this and you were just heading out on the real book tour when COVID hit and stopped that. But there's some really interesting stuff in this book, that is is very personal about you, particularly your personal health situation that this came out of. But obviously your professional work too, that's just been building up to this for a long time. And then there's this whole issue of how the subtext of the book, if I hold up the camera, please, is how women can lead in the fight towards universal healthcare, right?
Yes.
Which is, something that I know there's a lot of discussion about women being the head of the household, women making healthcare decisions, but let's be fair, let's be truthful, they have not been, with politics secretary Nancy Pelosi in 2010, dominant on the healthcare issue. So let me start with that question. Why women, and why did you focus on that area of the sort of for the book, given the number of books that have been written about all the different things we have to do to change healthcare?
Yeah, well, I realized this is a book that had not yet been written, and and I thought women didn't really have enough on their plate, so I should just add to it. No, sorry, late in the day. So when Donald Trump was elected, which was something that horrified many of us, given how he campaigned, as you may recall, he said, I'm going to repeal the Affordable Care Act on day one. Fortunately, that didn't happen. But at that point, it seemed like the stars were aligned, given the Republican leadership, that it was going to happen. A countervailing force was the Women's March, which I participated in Washington, D.C. The first one, actually, I did every single one of them. But that first one, where millions of people came together peacefully to protest and really to put forward on their signs and through the chants the world they wanted to see. And I saw all the signs about healthcare being a right and about saving the ACA. And this was from folks who, admitted that they'd never been to a march or been activists ever in their lives, combined with people who had done a lot of that. It was an incredible coming together. And the power of how that felt, I will never forget how that felt. And the fact, so it was massive and it was peaceful. People then said, what's next? I mean, here we are today. What do we do with this? And at that moment, I didn't have an answer for that. I just knew I needed to do something about the ACA. But that feeling of the women coming together stuck with me. And so as I started to go through the rest of my 2017, which, yes, involved some personal health issues, was not a great year. But I hadn't seen 2020 yet, so now 2017 doesn't look so bad. But in any case, in kind of cogitating on all of these things and remembering that feeling, I think as I got towards the end of 2017 and the Me Too stuff came out, I just hit this like last straw moment. On the negative side, it was just like, really? We have one more, this has been happening and swept under the rug for so long with so many people I even knew and no one had shared their stories. The confluence of all of that and thinking women are not as far along. And I admit I'm a privileged white woman, and I thought things were much more equal than they truly are. And so this sense of looking at my baby was like the Affordable Care Act, but my life as a woman was also just so much at the fore that year. And caregiving was coming into play big time for a bunch of reasons in my personal life. And I said, this is, enough is enough. And it kind of came together. Sometimes I've said it's almost like, maybe you'll remember these, Matthew, the Reese's peanut butter cup commercial, the chocolate and the peanut butter, and you put that together. Okay. It was like, oh, if I put the feminist angle on the ACA piece, like, I just lit up, like, that's it. That's the thing, because people have done one or the other, but they haven't put it together. And that's where I have passion, and I think something to say that others haven't already said. That's a long way of answering your first question. I'll also say, as I lead in the book, women make 80% of the healthcare decisions in the home front, and that was something I discovered as I was researching the book. I mean, I felt like I knew that anecdotally, but actually Department of Labor studies showed that. And that just struck me like, okay, there's some hard evidence. And there's plenty of others looking at how women are taking the lead on caregiving. And now with the pandemic, it's only become exacerbated. And yet when you look at the power structure and the fact that women are still only 24% of Congress and have never made it to the presidency and are minority of the governor, on, the gap between what our responsibilities are versus what our power is profound and just wrong, in the year 2020.
I think that we saw, the power of, well, you see the power of women in a lot of elections, right? And I think this one in particular, there was, those suburban housewives who swung it one way, right, or the other. And I'm curious, in the book, like the way I read it, and it's interesting because it's such a manifesto. Like I think from my perspective in terms of reading what you're writing, because you're advocating for women to kind of step up into this activist role, which you then talk about is just not a very comfortable role for a lot of us women. Like we're not used to that. And so you give us some tips about that. And the whole beginning of the book, I just kept going. I'm like, this is like the best history of why we need universal healthcare that I've read in like a really long time. Like it's concise, it has all the right statistics. It looks at it in a number of different ways from both like the system and then like the social determinants of health factor. I mean, you walk through economics, you walk through the politics, you walk through the history where we got employed. I mean, like this just kept going. I was like, okay, like I feel like armed with information, but that turn of the book where it starts to actually talk about the activists, that's where I was like, literally, yep. I was like, oh no, okay. I definitely am not one of those people who feel comfortable, who feels comfortable serving in that activist role. So tell me, I guess, your thinking there, and how did you maybe read our minds in the sense of what women need to do to feel more empowered in that. So in that role and understanding that, yeah, we make 80% of these healthcare decisions. How can we, speak up for some of the things that we believe need to be built into the system and do it in a way that's meaningful and that will actually have some impact?
So as I say, the Women's March was incredibly inspiring to me. And, we weren't even moving for so long. We were just standing because it was so crowded. You couldn't move. And so you would find yourself talking to the people around you. And, you came from here and this is how you started to hear the stories. And so many people saying that they hadn't really marched before. Now, I know that many people hadn't felt compelled to march because they were coming from a middle class, as you say, suburban kind of level of comfort, and hadn't been energized yet by Black Lives Matter or things that, maybe we should have been doing, frankly. But this galvanized so many people. And so I do try to give shout outs to the folks who are my heroes or sheroes, like Gloria Steinem, like Angela Davis, who have been activists always, but they welcome people who have not seen themselves that way. We have to join forces. And that's what I felt at the Women's March, was that you didn't have to be a professional activist to be an activist. And it was this big aha. And that in fact, it was, you could get out of your comfort zone and actually find maybe a new comfort zone. You found kindred spirits, and that there was incredible, it was energizing, it was empowering. And so that's what I wanted to share with people through the book, is that I'm not going to judge you whether, you may think I'm not that person. I just want everyone to move a little bit out of their comfort zone and try that, because if enough of us did that, we really could collectively make our voices heard. And so that it's taking that inspiration that I felt and trying to convey that, and not in a judgmental way, because I don't think that's not going to win over any people. It's like, start from where you are, and here's where you can move.
I wanted to ask too, because this was part of this for me. So it's like, I get that activism is like a way to affect change. But to the previous point about the women making 80% of the healthcare decisions, we're responsible for a lot of spending. And one of the things I wanted to ask you when I was reading this, that I just didn't feel like as I'm flipping through the book, I'm like, is she going to talk about like purchasing power? Like, how do we leverage our personal purchasing power to like do this better? So Rosemarie, how do we leverage our purchasing power to do this better? Because that was one of the pieces I felt like I wish you would have talked a little bit more about this, because some of us who may want to tiptoe into activism feel better about making, you know what I mean? It's showing our support with the dollars because it's, anonymous in a way. But, that hurts. That hurts in a meaningful way. To the people who are making decisions at the top of some of these, organizations, or who are making decisions about how we receive healthcare, when, how much it costs, all of that. So how can we wield our purchasing power in a way where we are acting as activists?
Yes, so I did think about that and did not write a ton about that in the book, as you noted. I decided to put more of the emphasis on making systemic change through the political system. And I don't want to conflate purchasing power with like making donations to candidates, but there is a true aspect of that women are not giving as many of the political donations. They give about a third of the political donations, both in dollars and volume. And so they're not wielding power and influence in the system. And not that I think that politicians should be bought, but we have to deal with the world we're in. And so I do make a case for women exercising some economic power through the political system. Through the economic system, it's a little trickier. I do very much think that every health insurer and every medical professional should be saying that healthcare should be a right in this country, and that they shouldn't, and so that shouldn't be some opaque thing. I am delighted to see that the American Medical Association is now saying healthcare should be a right, and you should ask your own doctor, do you believe this, and what are you doing to push this agenda forward? And you shouldn't be signing up with an insurer that isn't making public statements to this effect. And I'm not saying they have to be for Medicare for all. In fact, as you've read the book, that's not the stance I take. That's a bridge too far for many. Mm-hmm. But at this point in time, there should be a universal cry out, particularly from the medical establishment, that healthcare should be a right in this country. And people will listen to those folks in the medical establishment who do wield additional power and influence. So if you, as a purchaser of healthcare, can make that part of your statement, there's a lot of layers in between, but that might be a way. No, it's not as simple as saying, I'm not going to buy cotton balls from this, or drugs from here versus there. I don't think it works quite as well as it does in some of the things, like does a company take an environmental stance? And we.
Who would have thought we would ever see Impossible Meat burgers being brought into a menu at a McDonald's or a Burger King? But I think a lot of people who are motivated by, ethical treatment for animals, somewhere along the line, like they became a market. So I thought that was an interesting, I was curious about why that wasn't included. And I thank you so much for answering my question. And I think that the way you did explain kind of how to integrate that in really does, I'm satisfied.
I happen to have had last night. I had one of the gobble meals, and there was it was a steak meal, and I just bought some Impossible Burger because I never bought one in the supermarket before. I bought it and I cooked it up. My children actually ate it, which is a bloody miracle. So who knows? But talking about that, the Impossible Burger consumer movement. Do you think there can be, because it didn't come out. Your answer there was interesting. It didn't come out loudly, but it doesn't sound as though you think there's a purchaser movement that can lead healthcare. And you say some things about employer-based health insurance, which it's kind of probably politically it's not the necessary evil. You can't get rid of it, but doesn't seem to be making that much waves. Do you think there's a way that this can be done without federal policy action, or is that the only thing we can get? Can healthcare be improved in any way beyond that?
Well, there's lots of things at the margins that can improve healthcare, but it typically is improving it for people who already have some level of means and some level of coverage. And that's why our country compares so unfavorably to other countries that have universal healthcare, because when you average it out, we're leaving behind too many people on just covering basics. And so, and that's not in the economic interest of most companies. Companies are going after the people with the dollars, or, the folks who have the dollars because their employer is paying for the insurance. I do.
Well, let me push on that a little bit, because you touched on this, and it'll go back to where, your role in the Massachusetts Health Connector, where you were the COO. What about this notion that, you could organize sort of more consumer friendly and patient centered services for, say, the Medicaid population as that grows?
Mm-hmm.
You could do things which actually you improve people who've been poorly served, but they're not paying with their own dollars, but are paying with public dollars. Is there anything in that you think that is doable? Or
Oh, absolutely. And in fact, my company works on a lot of those kinds of projects with trying to launch really effective Medicaid ACOs. And that brings in addressing social determinants, which, as you note, I have a chapter on.
Yeah.
So I do think we can move the needle that way. Absolutely. But that's relying already on a coverage program that exists and more robust in some states than others. But the Medicaid program, it's filling in those gaps for people who don't have, frankly, Medicaid is pretty darn good coverage because you don't have as many of the out-of-pocket costs. So people are less likely to forego preventive treatments and that sort of thing that people who are facing high deductibles, it's almost as if they're uninsured because they can't face those out-of-pocket costs. And so that there's a growing gap there of the underinsured, and I talk about that in the book. So it's a patchwork as I use that metaphor, and I think we've got to smooth that out a lot and raise up the folks who are not getting the preventive care and the things that really would improve the overall population health. So absolutely. And whether there would be a consumer movement for that, I still see that needing to play out through the political system because the money isn't going to come from corporate America suddenly deciding that we'd like to fund folks who've been left behind. I mean, that's just not what they do. They move over to can we do concierge service? Let's go for the super wealthy and give them extras. I mean, honestly. So you have, in order to reduce the profound levels of inequality in our society, it does take more of a political and systemic solution. And that's where I decided to put my emphasis.
Yeah, I thought it was really interesting the way you started with the sort of the middle chunk of the book, which is you can almost read the chapter titles and it says employer sponsored insurance won't save us. The ACA only got us part way. There are people left uncovered, and then you end up with coverage alone, even if you did cover them, isn't enough, which is a bit about the social determinants of health. And that kind of is a great explanation of what the hell is wrong with healthcare even post ACA as to where we are now. And a lot of those numbers, even with the ACA and the Trump administration, are getting worse. But all those other numbers, the social determinants have been getting worse as well as inequality spreads. And you mentioned it's come to the head with Black Lives Matter and et cetera, et cetera. I think it's a great explanation. Everyone should read that because it's really great grounding and encouragement. Where you go next is kind of in the political solution part. And you said what you didn't espouse. So why don't you say what you do espouse? What you think we actually, is the political solution that could make it in the US?
Well, I also then got to the activism part, and I just, before I forget that point, when I went to a writers workshop conference and I was pitching my book idea, and people said, "Oh yes, please write this book." Easy for them to say, that sounds really good, but would you please not spend the whole book talking about the problems? Please tell us what we can do, because I'm sick to death of just hearing about problems. And that was a big aha, because I was ready to elaborate on all the problems and spell that out to the nth degree. So that part of the book really got shortened and moved along to the what can we do. And to lead into the what we can do, I needed to give people some vision of what's possible. And I feel like in this country, we get too locked into thinking there's only two other health systems besides ours. There's England and there's Canada. And we can't, and then the conventional wisdom is we can't do either of those. So therefore, we have what we have. And so I wanted to paint the picture of other possibilities. I used Germany as another example. Could have picked any number of countries, but I tried to simplify to not have too many things, bubbling around in people's heads. And I liked a lot of aspects of what Germany has done. And the point is that it's a hybrid solution where there's still a lot of private sector involvement, but the government has set standards and guardrails so that again, universal health care is achieved, but it's not completely government run by any stretch. And again, a number of other countries have hybrid solutions in that sense of a public and private combo. So that was the beginning of pointing the way towards something that I think this country can digest. And as fraught as the Affordable Care Act has been, I try to remind people that it really was done in a bipartisan way in Massachusetts by then Governor Romney and a fully Democratic legislature, business community on board, and advocates on board, all coming together. And so I felt like those very strong principles that were then built into the ACA, unfortunately got too toxically polarized, but that we were missing the point of really how the framework could be still, in my view, more broadly accepted, hopefully bipartisan, but certainly you see insurers have been supporting the ACA, and even as the Trump administration was undermining things, they were pushing back, compared to what happened with Clinton trying to do health reform, where the insurers were, basically deep sixing the whole thing. So in this country, we have to find a way where government has a role to be a catalyst, to do some enforcing, but that the private sector is still very much there, because that's really who the public trusts more than they trust government. Whether you like it or not, that's the reality. And I tell a lot of my liberal friends that you may think government's going to be the answer, but most of America would not agree with you. And so that's why I keep coming back to this hybrid answer. And I'm not going to spell all of it out, but I'll say that it does look awfully like what Biden-Harris platform is. Not that I knew what it was when I wrote the book.
You didn't know there was going to be a Biden-Harris platform when you wrote the book.
No, I didn't.
Another thing that we didn't know, and I think I want to wrap it up on this. Like, what do you think the impact of us all living through this public health experience of COVID-19? If you drop your book now, and that wasn't even like a possibility when we were writing it. Now here we are in the middle of this pandemic. Well, God knows when it's going to end. So we don't even know if it's the middle or not, but it just keeps waning on and on and on. And I feel like there's been obviously a rise in the collective consciousness about, public health and healthcare coverage and how much things cost and who gets distributed what, and throw in there, the Black Lives Matter movement, access and equality and things like that in healthcare. So do you feel like the pandemic has changed the way your book is going to be received in any way?
Well, I can always hope. It's when you're coming through a crisis like this. I actually use the analogy of like the stages of grieving, and at first there's like denial and there's anger, all of that, and we've been collectively going through these stages. But at some point, you come to a stage that has been added, which is called making meaning of what happened, of a crisis or a loss. And I think this book helps people to make some meaning out of what's happened. And as we look at like, the Great Depression, and then the social safety net programs like Social Security that came out of that great crisis, I think we have an opportunity, and we can't fully realize it, I think, until we get more close to the vaccine and truly solving the most immediate difficulties of this crisis. But right there, we need to be ready, because I think the moment to make the case for universal health care comes to us again, somewhat like Obama had with the Great Recession in 2008, 2009, and then pushing through the Affordable Care Act, because people's lives were so impacted just from a regular old economic recession, not a public health crisis and, recession/depression. So I like to think of a crisis as an opportunity. We're not quite ready to seize that opportunity. We've got to still get out of the crisis, but we absolutely should then run with this and push forward, because you don't get many moments like this. And there could be another pandemic. I hate to say it, but we need to be better prepared for the next one. And we will be stronger as a society, not just our health, but frankly, our democracy will be stronger if we have something that everyone is getting, have something like universal health care, where more people feel bought into what the system is giving them. Too many people have been left behind, and it's affecting our politics for the worse. And so I see it as a potential unifier. So I'm going to talk myself I was going to say till I'm blue in the face, but maybe some days blue, some days red. I'm just going to keep talking about this as long as people will listen, because I think it's an opportunity.
So I got to say, Rosemarie, I agree with her. I wrote a piece in 2002, 3, 4 about saying, I thought in the end, the Republicans would be the ones who would pass some kind of universal health care, a la Mitt Romney, because it would take the issue away from the Democrats, right? And if you looked at the demographics of who was now the new, and look, I know a lot of people who made more than $1,000 a year, but Republican, but nonetheless, the expansion in evangelical Christians and white working class, non-college educated people in the Midwest, those are the people who need. Many of those people are the ones who who have been hit by the inequality, obviously who newly perhaps need it. And it seems to me that nobody in the Republican Party has decided to go after that and say we will fix the problem for those people. And it's either because they don't care, they don't think it's an opportunity, or that those people don't care about it. And some people, come up with this, I want to say, well, that group of white people wanted, union-based care. They just wanted to make sure those people didn't look like them got Medicaid or didn't get universal care as well. Why hasn't that happened?
Oh, it's a very good question. But I take the example of Kansas, where I did some work last year on trying to push forward with Medicaid expansion, which is, a case study. And its neighboring states, Missouri and Oklahoma, this year passed through ballot initiative Medicaid expansion, but that's not an option in Kansas. And so we were talking a lot with the business community, hoping that they could make the case to the Republican legislators to do something about this. And we came pretty close. Didn't get all the way there, unfortunately, but it got a lot closer. And I was very heartened by all the conversations I had with folks in the business community who saw this as a really vital economic issue in terms of their workers' health, well-being, productivity, and also the fact that rural hospitals have been closing. And all of those things are affecting the fabric of their state, and they saw that. And so while it didn't comport with the national rhetoric of Trump and company, it was like being felt on the ground. And so, and then again, seeing this year what happened in Missouri and Oklahoma, I do see that as hopeful sign. It's slow going. And so, it's frustrating, but I think that's once those things are understood and come together, we don't tend to recede from them. And one of the great successes, as we talked about, of the Affordable Care Act is the fact that now both sides are saying we want to protect people with pre-existing conditions. And that was not the rhetoric 4 years ago. I think that's huge progress toward making healthcare a right in this country.
Well, you're an optimist and and a troublemaker and an activist and a change maker, and there's other people who change the world. So I've got to love you for that. And I'll just say my final comment. It really fascinating book. It's 4 books in one. Somehow you got this in under 200 pages. It's 4 books in one. It's kind of a personal experience of your experience in the healthcare system as a patient and as a caregiver. It's this great sort of history of how we got here. It's a political political sort of pathway of how to do next, and then this is part about how to be an activist. So how you crammed all that into 200 pages, I don't know, but it's an excellent book. So congratulations.
Thank you. Well, I'd like to give a shout out to my publisher, Beacon Press, because they are masterful at working with authors of experienced and inexperienced to get it to a place that people might actually want to buy the book. So thank you to them.
Great Christmas present for those who might be shopping online.
Oh, thank you. Yes, please. Or support your local bookstores.
And I will say this, as I was reading through this, I was like, I'm like, part of me is like excited about the fact that you added the gender aspect to it, because I do think that we need to be encouraged as women to speak up more. But there's so much, like Matthew said, it really is like 4 books in one. The part about to me, the part about the history that you walk through, and also your ideas for how this could work, where it is a blended system, but you walk through all of the other models and then talk about why they would and wouldn't work. I feel like all of that is it's like universal healthcare 101. Like everybody should be made to read that, just because I think it helps. You explain the issue in such a way where I felt like it was really quite well-rounded and definitely very robust. So thank you for that. Like I said, Christmas, stocking stuffer.
Thank you. Well, and some of my biggest fans, what surprised me, because yes, I had a target audience in mind and I was encouraged to think hard about that. But it's been delightful to find so many guys who have read this book and said it's one of the best books they've read on healthcare. And I said, wow. And you weren't exactly my target. And he said, but I learned so much from it because yes, there's a 101 aspect, but also I needed to see your perspective on this. I learned from that too. And I very much appreciate that because we need allies.
Yeah, totally. And we need role models. So thank you for putting this together because I don't think there are enough
Thank
women
you.
writing about this stuff either. And all of your work contributes to this in healthcare and leading the way politically. Appreciate it, Rosemarie. Thank you.
Thank
This
you.
is a great day. The book, again, for those of you who are anxiously awaiting to type it into the search bar in Amazon, Marching Towards Coverage, How Women Can Lead the Fight for Universal Healthcare. Thank you so much for joining us today here on the THCB Book Club.
Thank you.
Mr. Holt, always a pleasure. I'm Jessica DaMassa. For those of you who want to make sure that you figure out what we're reading next, please check out thehealthcareblog.com. And you can also subscribe to our newsletter there. We usually announce the book in advance so you guys can follow along if you'd like. Just to do that, go to thehealthcareblog.com and hit subscribe. That's all. We'll see you guys real soon. Thank you so much for joining us. Rosemarie, thank you again.
Thank you. Appreciate it.
Bye.